Everyone. I'd like to call this meeting to order. I'm going to ask for roll call to be called.
Member Banham. Membre Cloutier.
Présent.
Vice Chair Di Giovanni.
Present.
Chair Eglai.
Present.
Member El Shantiri.
Present.
Member Gower. Member Kavanagh.
Present.
Member Lakin. Member Menard.
He is.
Yeah. Member Pinel.
Présent.
And Member Tilley. You have quorum, Mr. Chair.
Thank you. We have two regrets, Members Lakin and Tilley. Member Menard is on his way, as I understand it. We have no declarations of pecuniary interest. Could we have confirmation of minutes of the meeting of September the 16th, 2019, please? Okay, thank you. Carried. Thank you. We have 17 communication items that have been received and held on file, and they're as listed. I'm going to ask Vice Chair to move the motion to introduce reports tonight.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Next Steps in Harm Reduction and Overdose Prevention, Child Visual Health and Screening Services, Board of Health Travel Policy, and Enhanced Code of Conduct, attendance at the Association of Local Public Health Agencies, ALPHA, 2019 Fall Symposium, and the Board of Health Section Meeting 2020 Ottawa Board of Health meeting schedule be received and considered. And be it further resolved that the rules of procedure be suspended to receive and table the report titled 2020 Draft Operating Budget for the Ottawa Board of Health.
Thank you very much. Carried. Carried. Thank you. We'll go through the agenda quickly. So we're going to hold the my verbal report. We're going to hold Dr. Etch's verbal report. Next steps in harm reduction, overdose prevention, rather. We're going to hold, we both have a staff presentation and we have a number of public delegations. Number 4 is the 2020 draft operating budget for health, which we'll be tabling. Again, we have a staff presentation, so we'll be holding that. Child visual health and vision screening services. There is no staff presentation, and we would be receiving this for information. It can be held if anybody has any questions. No? Received and approved, yep. Okay, thank you. Next, we have the Board of Health Travel Policy and Enhanced Code of Conduct. Again, there's no staff presentation. If there are questions, we can hold it. If not, we can carry it. Carried? Carried, thank you. Number 7 is attendance at the Association of Local Public Health Agencies Alpha 2019 Fall Symposium and the BOH section meeting. This is to approve the attendance of members Banham and Tilley at this week's Alpha Fall Symposium. Carried? Number 8 is the 2020 Board of Health meeting schedule. This is to approve our 2020 meeting schedule as set out in the report. Carried? All right. I'm now going to ask for a slight shuffle of the agenda and ask that we deal with item number 3 first. Which is the harm reduction report, for 2 reasons. One is we have a number of delegates here to speak to the matter, and secondly, downstairs, and Deputy Chief Bell will appreciate this, are the Crime Prevention Awards, and there are a number of people sitting around this table that have resident groups that are going to be acknowledged tonight for the good work they do. So at some point, myself and Councillor Cloutier and Councillor Kavanagh will leave the room briefly, and the Vice Chair will take the meeting until we get back. And but we had the discussion. We think it's important to recognize the work that's going in the community. I know Deputy Chief Bell and I have talked many times about the intersection between public health and the work that the police do on crime prevention. So it's a good nexus. So if everybody's okay with that, we'll deal with item number 3 first. Okay. I would ask staff to come forward then, next steps in harm reduction and overdose prevention. And I believe that Andrew, our Director of Health Protection, Andrew Hendricks, is going to speak to the PowerPoint presentation. Thank you, Andrew.
All right, good evening. Tonight I'm here to speak with you about the next steps Ottawa Public Health is taking in our harm reduction and overdose prevention work. I'm joined by Kira Mandrick, Supervisor of the Harm Reduction Program. Our presentation will provide you with an overview of the information presented in the report before you, and it highlights the work that OPH has done and will continue to do to combat the ongoing opioid crisis. I'd like to start by saying that OPH continues to take a broad approach to mental health and substance use in Ottawa. This work involves several programs across our organization, including school health, chronic diseases, mental health and substance use, healthy growth and development, and the focus of this report, our harm reduction team. Our surveillance team continues to monitor and report current and emerging data that assists all of our programs to target our interventions to maximize impact. I'll speak to some of the data in the next couple of slides. We know that addressing stigma is important to ensure that people get the supports they need, and so our health promotion teams are partnering with organizations like the Canadian Centre for Substance Use and the Community Addictions Peer Support Association on anti-stigma campaigns. It's important to mention that addressing mental health and substance use cannot be done by one single organization, and so we've been integrating our approaches with as many partners as possible so that we can collectively better serve the community. We're pleased to have a number of delegates here to speak to these partnerships. To highlight this work, in 2019, OPH partnered with the Royal and the Ottawa and the Community Addictions Peer Support Association. We brought together almost 200 participants to share their perspectives, discuss and vote on ideas to prevent problematic substance use and promote mental health in Ottawa. This included people with lived and living experience, as well as partners and stakeholders with varying perspectives and expertise. Through this, the Ottawa Community Action Plan on Mental Health and Substance Use was developed. There are three main areas of action within that plan, one of them focusing on advancing harm reduction initiatives that can reduce harms associated with opioid use. And this is the focal point of the presentation this evening. This map illustrates opioid overdose emergency department visits in 2018 by the postal code of residence. While it shows that a larger number of visits were from residents in the downtown core, overdoses occur across the entire city's geography. Within the report, we also highlight a near quadrupling of the rate of opioid overdose emergency department visits over the past 10 years. In addition to this, hospitalization rates for opioid overdoses have more than doubled in that same time period. This map highlights the unique role that public health must play in responding to the opioid crisis, given its mandate to take a population health approach and focus on the health and well-being of the entire city, and also reducing inequities among those at higher risk of opioid overdoses. Switching to mortality data, we received more recent data from the provincial coroner that will help us tailor our interventions in specific areas. Unfortunately, in 2018, there were a total of 82 opioid-related deaths in Ottawa, which is a 28% increase when compared to 2017. More detailed information from the coroner reveals that fentanyl contributed to almost 3/4 of deaths, that middle-aged men were disproportionately affected when compared to women, that most of the deaths are occurring in a person's home, often with no one present to intervene, and that naloxone was only reported as being used in 1/4 of deaths. In addition to this, we know that drug checking data from Sandy Hill Community Health Centre that illicit fentanyl was found in 97% of street drugs that were brought in as opioids, and that almost 50% of drugs brought in as stimulants also contained fentanyl. So the data continues to point to a toxic illicit drug supply here in Ottawa. This data, as well as the work identified in the Community Action Plan, provides a framework to guide the next steps of our OPH harm reduction program. Our harm reduction program, including supervised consumption services, has been discussed and supported by the Board of Health over the past few years. With the existence of a local toxic drug supply, an ongoing increased risk of overdoses in Lower Town, Ottawa Public Health will continue to provide harm reduction services, including supervised consumption services, at 179 Clarence, with a transition plan at least until renovations are completed at the Shepherds of Good Hope site. OPH will continue to monitor the needs of the local neighborhood level as well as citywide, and we will adjust operations as required. As of January 1st, 2020, we recommend that our harm reduction program drop-in services return to its past service hours, which were 9 to 5. OPH recognizes that a shift in operating hours could have an impact on clients accessing our services as well as other services. As such, OPH has engaged clients and neighboring supervised consumption services to develop and support a transition plan, which includes facilitating referrals by physically accompanying clients to other supervised consumption services, and also positioning OPH staff on site at other locations for a temporary period as long as needed. These methods were successful when transitioning clients from Overdose Prevention Ottawa to OPH and the Shepherds of Good Hope in the summer and fall of 2017. Making this transition will allow us to focus on other harm reduction areas that require our action based on the data and the coroner data that we also received. We know that OPH is uniquely positioned to play a preventative and a more systematic approach to overdose work across the entire city. One of those areas is to promote the integration of harm reduction approaches across allied service partners. This means working more closely with partners like hospitals, primary care providers, so that they can also build their capacity to foster a harm reduction approach in their healthcare setting and to better serve clients. An example of this is our new partnership with the Royal, where we work side by side with them to formalize their harm reduction policy and their services for their center, including take-home naloxone kits, safer drug use supply distribution within their programs and services. Partnerships like these will help bridge the gap between mental health and substance use services, ensuring clients are at the center of care and are provided access to the wraparound services that they need. The illicit drug supply across Canada and here in Ottawa has also prompted organizations to consider new approaches to address the opioid crisis, such as a safer supply initiative. A safer supply pilot seeks to provide a pharmaceutical opioid prescribed by a physician to people who use drugs in Ottawa as an alternative to the contaminated, illegal, and toxic drug supply. Locally, in partnership with Respect RX Pharmacare, Recovery Care Ottawa, Ottawa Intercity Health, Somerset West, and Sandy Hill Community Health Centres, OPH has submitted a joint application in response to Health Canada's call for proposals for agencies to implement a local safer supply program that would last over 4 years. If successful, this pilot will aim to provide services to approximately 500 clients who are at the highest risk of overdose and in need of treatment for opioid substance use disorder. And the final priority is to expand our outreach to residents that are at high risk and are hard to reach. This work is important when reflecting on some of the coroner data that indicates that some people are dying alone in their homes, often with nobody to intervene in the event of an overdose, and often with no naloxone nearby. Despite Ottawa's success in distributing over 20,000 naloxone kits to residents across Ottawa, we still have work to do to get them in the right hands of the people who are dying from overdoses, and to reduce stigma to ensure that those who need support receive it. In partnership with the City of Ottawa Housing Department, we have begun some of this outreach in licensed rooming houses, but more outreach in this area is required. For example, we will work with people who are seasonally unemployed, as this population is also at higher risk for overdoses. Before taking questions, I'd like to take a moment to convey my gratitude and thanks to Kira and her entire team, many who are behind me this evening, for their contributions in expanding harm reduction services, including supervised consumption services in Ottawa. We hear from clients every day that these services make a difference, and I'm truly grateful for their work. This concludes our presentation for the evening. Thank you.
Thank you very much, Andrew, and I echo your sentiment. The team's done amazing work, and even more so, they've done amazing work in adapting to the changes that have been imposed upon us by the province. So some very creative thinking, some real collaborative teamwork, and that's much appreciated, as is the new direction that public health is looking at going, with the possibility of the funding from the federal government to look at the safer supply. I know we had several meetings about this, and you guys kept saying to me, Chair, don't say safe supply. There is no such thing, and you're absolutely correct. But I think this allows public health to look at this through an entirely different lens, and an important lens. If anybody in the federal government is listening, we're really hoping this comes through for us, because we think we can make a difference in the city with this project. I know some of my colleagues will have questions, but we're going to go to the delegations first. And I'd like to first call up Deputy Chief Steve Bell.
Good evening, and thank you very much for having me here tonight. And it's a different side of the table for me, so I'll try not to make it ring out. So first I'd like to start off by saying that I truly appreciate the strong partnership that we have between Ottawa Public Health and the Ottawa Police Service. Good partnerships exist, not just because people at the executive level want them to exist, it's because leadership teams, frontline workers actually work hard on them, and I can tell you that's absolutely the example of our experience. We've worked collaboratively on several different issues over the last period of time, but I'm actually most proud of the work that we've done together around opioid use and overdoses here in Ottawa. I'm encouraged to see the work that's been laid out today in terms of the next steps in harm reduction and overdose prevention. What it highlights is that this is not one person's issue. This is a community issue that we need to address. When we work in isolation and alone, we make no progress on this issue, so that cannot be the way we move ahead. I'm very happy to say that we're part of the Interagency Overdose Prevention and Response Task Force, and it's a great collaborative that works together to address the alarming number of opioid-related deaths that we've seen in Ottawa over the last number of years and that appear to be growing. I'm going to go through a couple of the key areas that we've focused on to show the strong partnership and some of the progress that we've made over the period of this task force. So the first thing we started to address was the supervised consumption sites that Andrew spoke about. And I can tell you the work we've done collaboratively on that has allowed the OPS and has forced the OPS to change our response model. I can tell you in the existence of the time since those have been in place, our mentality around people affected by drug addictions has changed, and we work very hard to modify our response options so that we don't criminalize those people, and we work with our service providers in order to allow them to get the supports they need. We've also been able to work on the Good Samaritan law and the promotion of that from a policing perspective, to train the public, to let the public know, and to train our frontline members to know that when people call somebody that's in crisis around opioid overdose, that we won't be pursuing criminal investigations and that there is no risk to them in terms of that. And I think we've had some good success around that and are starting to see increased numbers. This task force also allowed Ottawa to lead in terms of the frontline provision of naloxone to its police officers. We were one of the first services across Canada to equip all of our frontline officers with naloxone, and I can tell you that it's had a huge impact. We've used it dozens of times. Our members have used it dozens of times, and helping to save what we think is countless number of lives. Now we turn our attention to the Safer Supply Project. We're very engaged in it. We're very interested in helping support public health as they move ahead on this project because we think it will have real benefits to our community. We're already currently involved in the inner-city health pilot, and we've been able to, through good partnerships, navigate some of the challenges as that program has rolled out. I can tell you, as we've gone through, there have been challenges and there have been gaps, and it's the partnerships and the good dialogues and discussions that are immediately allowing us to clean those up and allow for a good introductory phase of that pilot. We have high hopes for the pilot. This community should have high hopes for the pilot because what it does is it puts opioid users first and the communities that they live in to make them more well and safe to live in. We know the program will provide a safer supply of opioids, and in that, we'll anticipate seeing less crime committed by the people looking to access drug money, less overdoses related to the toxic supply of drugs, and better linkages to support like primary health care and addiction services for the people within the programs. The last partnership I'd like to talk about is our newest partnership and the one that's most emerging, and that's around the change in how we provide service from a policing perspective, from a health perspective, and a city perspective at some of our communities that are most at risk. You'll know that recently the Ottawa Police deployed their neighborhood resource teams, and as part of that, Ottawa Public Health and the city, along with social service agencies, is looking how we can support that model. It's interesting when Andrew brings up the heat map, it's directly in line with the areas where we are deploying those resources. And our hopes is that as we work together, not only will we be able to help identify individuals in need and have need of public health or other city services, but it will give us the opportunity to identify some neighborhood-based solutions so that we can move away from having to respond to the individuals and put the systems in place that will help from a prevention perspective. I'd like to thank Dr. Etches for her leadership. It's been amazing. The way she's led the partnerships and the way she has the forward progressive view to help take this community and its systems to the next level. I think Public Health is very fortunate to have her. I think the city is very fortunate to have her, and I enjoy immensely working with her and finding new ways to collaboratively deliver our services. I'm very happy to have an opportunity to address this board tonight. The opioid dependency and its effects on the city aren't a public health issue. They're not a policing issue. They're not a social service issue alone. And it's the collaboration that we have and the work we do together and the systems that we change in order to reach out and help those individuals and those neighborhoods that need it most that will be a sign of the effectiveness. I'm very happy to see that deeply woven into the action plan that you're speaking of tonight. So thank you for the time.
Thank you very much, Chief. I appreciate you coming out, and also appreciate the comments you're making about the shift in the police lens, if you will, in terms of not criminalizing the individuals. And you know, I'm hoping one day OPH stands for Ottawa Police and Health, and we truly work together as a joint organization. And we're getting there, and those efforts are appreciated, so thank you very much. I believe Member El Chantiri has a question for you.
Thank you, Mr. Chair, and thank you, Deputy, for your presentation. Deputy, you spoke in community meeting many times before about this issue, and you've always been a strong believer. It's not a just police issue, it's not a just mental health issue, it's all of us issue. Now, knowing police always looking for evidence-based information to be able to adopt something. Where's the base evidence information do you have about the safe supply? I'm just interested in that because we saw a report in the past that said everything, but they didn't recommend a safe supply. Like, do you have concern about the safe supply sending a wrong message, different message out there?
So thank you for the question. I think the evidence in terms of the safe supply actually comes from the epidemiologists that say 97% of all of the drug supply on our streets contains some amount of fentanyl that we know is deadly to the people using it. The opioid addiction and the root cause issues are not going to be solved by a safer supply of drugs, absolutely. But I think beyond the prevention piece and looking at how we wean our society off opioids and the use of opioids in our mainstream medical profession, that we have to actually look at what is the issues we have right now in front of us. And that's the fact that there are dozens, hundreds of people who are addicted to this drug in our society today, and the only way that they have to access it is through an illicit supply of toxic drugs that we know can and or will kill them in the future. So I think we have a responsibility as a community to actually address that in the current state, while we continue to try and look at what are some prevention and intervention methods we can use so that we can wean our society off the use of opioid drugs.
Thank you. Thank you, Mr. Chair.
Member Kavanagh.
Thank you very much, and thank you for your collaboration with Ottawa Public Health. Very much appreciated. I'm wondering, is this going to lead to more possible arrests in the future of sort of finding the sources of the illegal substances?
So taking off, sorry, your mic. Oh. There we go. So that's always a goal. One of our key responsibilities as a policing organization is the enforcement, particularly of those importing fentanyl into our society. We actively work with our federal partners, with the RCMP, and CBSA, our local and provincial partners, to look at how we can stem that flow. It's a leaky sieve. It's really challenging. The amount of fentanyl that is needed to be used in cutting a vast amount of drugs is very hard to detect coming in, particularly when you can get it through a mail system. So that's not to say that all of our efforts are lost. We continue to focus on new techniques, new manners that we can intercept the importation of fentanyl into our country, absolutely. But it's a real challenge, and it would not be a fulsome and wholesome approach in trying to address the opioid issue. It has to be one of the pieces, but it can't be the only or focused piece.
Understood. Thank you for your work on this.
Thank you very much. I don't see any further questions, so thanks again for coming out, Chief. It's much appreciated. Next delegation is Mark Barnes from Respect Pharmacy. Good evening.
Thanks again for having me. I do want to echo, I was going to start something a little different, but I do want to echo as a service provider and a pharmacist. I have seen a significant difference in policing just among my clients, which is wonderful to see over the last 4 or 5 years. There's been a different approach even from frontline officers on how they deal with my clients, the overall perception of opioid use disorder, what's involved in the treatment, and the tolerance that they, I guess, display every day. So that's wonderful to see. So I want to make sure that you guys are aware of that as well. There has been a change in Ottawa, which is fantastic, and the Ottawa Police Service actually has been a wonderful resource for us. So it's been excellent. They allowed us to do our thing, and we allowed them to do their thing. These neighborhood resource policing, I went to a presentation about a month ago, or a few weeks ago, regarding these pockets of neighborhoods in Ottawa that are going to have this, and it's going to be a wonderful resource for me in Vanier, because without it and without this perspective, the fear of treatment is a real problem with our clients. They're afraid of prosecution if we're coming forward saying, I have a problem, I use opioids illicitly. So with those resource policing, it's going to be fantastic. So that's an aside. After his presentation, I felt I had to say that, so that's important. Yeah, as you're aware from the report, the harm reduction report, several local groups, all with a direct interest in fighting opioid crisis, have made a joint application for federal funding. I'm a member of this. We as a city already provide supervised consumption locations where people can consume street drugs in the safest environments possible, supported by peer engagement and in the presence of on-site medical staff. Despite all the efforts of the wonderful and hardworking staff at these locations, overdoses still happen. These overdoses are directly linked to an ever-increasing potent opioid supply. In my 5 or 6 years as an addiction specialist, Ottawa's street supply of opioids have changed from heroin and OxyContin to fentanyl and carfentanil. And you have to understand that these things are 10,000 times stronger than the previous forms of opioids we had in Ottawa. Safer supply essentially is an extension of traditional harm reduction philosophy. I'm not a big person who thinks that harm reduction and treatment are separate. I believe harm reduction is treatment. Okay, it is a philosophy of treatment. The goal of this is to replace the toxic and contaminated street drugs with prescription alternatives for people who use these illegal substances and whose needs are not being met by the traditional, highly structured models of treatment that currently exist. The dropout rates of current treatment is about 48%. Right? Unfortunately, because the drugs are so strong now, if we step backwards and say, okay, guys, stop taking the medication, let's go into a traditional treatment program, it's really trying to fight a fire with a water pistol. It's just not going to work. We need to rethink about how we're going to approach treatment and look at, we need to stabilize somebody first. And stabilizing somebody at the beginning is providing safe alternatives. Clients will receive a one-day supply only of the medication prescribed by a physician and dispensed by a pharmacist. It includes long-acting oral doses that are observed and swallowed by healthcare staff, pharmacy, and sometimes staff at other group homes to ensure opioid tolerance, and also receive then a short-acting supply of oral tablets that they will have to consume, hopefully in the presence of supervised consumption services. These clients will have to check back in every week with the physician who's prescribing and daily with a pharmacist who's dispensing. This is not just an endless supply of drug to the street. It is medication. This application, if awarded, could see several hundred people receive safer supply services throughout the city. Ottawa's Safer Supply Program, not Safe Supply Program, we debated this for a long, long time, safer versus safe, this summer at Health Canada. It was quite a conversation. I never thought there could be 35 emails about safe versus safer, but there was. And by this framework that we've discussed comes from a lot of professionals across Canada, not just here in Ottawa. And it came together as a safer supply of pharmaceutical alternatives to street drugs, and it was an expert advisory group. I was a member of this group. Further to this, Ottawa is not alone in its request to provide safer supply programs. Such programs already exist in many other jurisdictions throughout Canada. Early results from these programs show that clients receiving safer supply have shown remarkable reduction in overdoses, a reduction in the transmission of infections such as endocarditis and HIV, a reduction in homelessness, a reduction in crime involvement, and a reduction in ER visits. It should also be noted that despite these existing safer supply programs providing flexible, low-barrier drug supply, there was still a high rate of uptake of wraparound services such as mental health support, primary care, and housing. In essence, people were highly motivated to be better. Currently in Ottawa, we have about 30 people in a pilot project of safer supply. Local feedback from these early days of Ottawa's program have shown that this unique program will work. And I'll just kind of end with a little story. 7 o'clock in the morning, about 3 days ago, I was dispensing safer supply to a client, and I kind of knew I was coming here, and I wanted to ask some questions. I said, so what do you think? What do you think of safer supply? What does it mean to you? And her exact words were, it stops the hustle. And she went on and was in tears within minutes discussing how she felt this was what it was doing to change her life, and that she didn't have to hustle for drugs, try to seek the drug, use the drug, find a safer supply for the drug, and what she had to do to get the drug. It gave her life back. So now she can spend time focusing on other things about getting better. And it's the first time in 5 years that her worker has spoke to her about housing. So, I mean, if that's not success, I don't know what is.
Thank you very much for coming tonight and sharing the real-life experience that you work with every single day. I think that's very helpful. Are there any questions? Member Couche.
Merci, Monsieur le Président. Thank you, Mr. Barnes. You've brought a lot of information. In safer supply and how we assist residents in overcoming the addiction and the weekly visits to the physician and the daily visits to the pharmacy. Has that model worked in other jurisdictions?
Yes and no. There's going to be challenges as we learn. So the yes part is that stabilize the client to be able to access a safer supply and to stop the overdoses right away. Lower all the things I mentioned, HIV, housing, that's worked right away. With regards to the pharmacy part, if a pharmacy is addiction focused, there is still the, I guess, the risk of other people who are not quite as stable being triggered by the terminology and seeing the drug and what's happening and how they're consuming it. It's kind of complicated in how it works, but ultimately we have to be very understanding and respectful of other people and their different levels of recovery and where they are. So certainly I believe it would be best served if these medications were authorized daily, but then delivered to a safe consumption site, right? But these models of delivery and logistics is something that we're going to have to work at as the program grows, and we're already consulting through partners in Ottawa about this. Ottawa Public Health, Ottawa Inner City Health, Somerset West Community Health Centre, Sandy Hill, and ourselves will actually get together and discuss logistics and what best serves everybody in Ottawa and the different levels of recovery that they're in.
Are you a pharmacist?
I am.
Yeah. And I note the name, Respect Pharmacy, and I'm just on your website, and not criticism in no way. I note the store hours.
Yeah.
How do we reconcile that? And not only in your pharmacy, but in other distribution outlets, pharmacies or other, with the needs of the patient?
I love how you looked at my website up. That's fantastic. If you want to put that up there, it'd be fantastic. No, I'm kidding. But on a serious note, logistics and having other partners that work in a 24-hour service is essential, right? So the daily delivery of the medication, or several times a day delivery of medication, can happen in regular operating hours. Our pharmacy, because we are a harm reduction focused inner city pharmacy, we're open 365 days a year. We haven't closed in 6 years. We have put that effort in to be open, to be available, to be accessible when someone's in crisis, right? Also, there's always after-hour care on-call services for consultation with our pharmacy services as well. The actual shop hours themselves don't reflect the service that we provide.
Thank you very much. I don't see any other questions, so thank you for coming down tonight and sharing with us. The next delegation is Don Lyons and Jeff Mason from the Somerset West Community Health Centre. Good evening.
Thank you for having us here today. I'll start off with a little bit of my story of my involvement with Somerset West. I'm a community member living in the Somerset catchment area who joined the advocacy committee about 2 years ago because of an encounter with a negative petition against the opening of the supervised consumption site at Somerset West. And I'm so pleased with how much progress has been made in the city in those 2 years and the work that Somerset West has accomplished regarding supervised consumption. So thank you very much for having us here today, and I'll read a statement that we've prepared. Somerset West Community Health Centre is a long-standing provider of health and social services, including harm reduction programming, in the Somerset ward, providing both our local community and the region. As one of the 4 consumption and treatment services operating in Ottawa, we are significantly supported by the work and leadership of Ottawa Public Health's harm reduction and overdose prevention activities, and are speaking here to voice our strong endorsement of the initiatives put forward in the Next Steps report being discussed today. As a community health centre serving many people who use drugs living in rooming houses, we are heavily invested in Ottawa Public Health's work to enhance the reach of overdose prevention services to those using drugs in isolation at high risk of overdose. Ottawa Public Health's leadership in this regard has enabled us to secure funding for after-hours overdose prevention in the Somerset Centretown and Carlington catchment areas, with a focus on housing environments where people use drugs in risk or isolation. This project has, and will continue to, benefit from the leadership and partnership from Ottawa Public Health, through surveillance data information sharing, service model development, implementation, and responsive service delivery. Our consumption treatment service serves approximately 200 unique individuals per month. Through our outreach service, or though our outreach services, we are aware that there are many more who do not use consumption and treatment services, instead using in isolation in apartments and rooming houses. Further, being the only consumption and treatment service in the Somerset catchment and operating only 12 hours per day, expanding interventions for those at risk after hours is of high importance to our organization and community. Our consumption and treatment services is operating at full capacity while the toxic drug supply continues to escalate in fentanyl strength and additional substance contamination. Most recently, the addition of the benzodiazepine analog etizolem has been linked to 5 deaths in Ontario to date this year. While the overdose crisis worsens, we are extremely concerned with the impact that the reduction in consumption and treatment services in Ottawa will have on the drug-using community and consumption and treatment service providers. Because of this, we are in full support of Ottawa Public Health's intention to continue operating their consumption and treatment service at weekday hours. The toxic drug supply is having devastating impacts on our clients who use drugs, not only due to the risk of overdose, but the variability of fentanyl potency in the illicit supply, plus the presence of benzodiazepine contamination, means that clients are experiencing increasing levels of oversedation, withdrawal, psychiatric distress, disorientation and amnesia, compromised mental state leading to inappropriately discarding syringes, poverty, and drug trade violence. Not only is it affecting the community of people who use drugs, but it is also straining the broader communities of friends, family members, service organizations, and neighbors who are striving to provide support during these tragic and chaotic times. Police Chief Slowly recently stated that 50 to 70% of police calls are related to mental health or substance use. Amid a city in crisis, experts in the field see the increase of safer supply as one of the singular most potent and effective interventions. Ottawa Public Health's leadership on the scaling up of safer supply in Ottawa is of paramount importance in our drug-using clients and communities who are desperate for a turning point in this continuously escalating crisis. Finally, considering the ever-escalating and unpredictable nature of this crisis, the leadership that Ottawa Public Health provides is critical for healthcare providers working to identify, respond, and adapt to the toxic drug and overdose crisis. The coordination that Ottawa Public Health provides for consumption and treatment service operators and related services, and more broadly to the harm reduction services and community, serves an important role in ensuring that all providers can leverage and maximize existing and emerging resources, practices, initiatives, and evidence. This is necessary for us to not only persist as we weather this crisis, working to keep our drug-using community members alive and our healthcare workers going, but to continue organizing and responding in a way that we hope and trust will allow us to come out the other side of the crisis with as many lives as we can. And as an organization representing healthcare workers and community members at the front lines of the crisis, let us say in the strongest terms that we require and rely on the continued leadership and support of Ottawa Public Health's harm reduction and overdose prevention work. It is no overstatement to say that these times of direst need, our organization and communities of people who use drugs depend on it. Thank you for your consideration.
Thank you very much. Are there any questions for the delegation? Okay. Seeing none, thank you for your, oh, sorry. Member Kavanagh.
Thank you very much, and thank you for your partnership with Ottawa Public Health. It's very important. I'd like to know, in terms of the demographics of who is being treated, I got the impression that it was across all socioeconomic groups, but we talk more about low-income people who are being affected. Is it sort of that it was people that were in different demographics that have sort of fallen into becoming low-income? What is the pattern here that we're seeing? Also, I find it unusual that it's mostly middle-aged men that are affected. I wonder if you have any insight on who is it that is getting treatment?
Thank you for your question. I'm not sure I can speak really broadly to that question, but what I can say is within the catchment area that we serve, we have actually the highest concentration of rooming houses in the city of Ottawa. And we know that we've done lots of research around the demographics of people who are living in those rooming houses, and it is a very vulnerable population, and a very large number of our clients who are people who use drugs are living in that context. So certainly folks who are living on low income, otherwise they wouldn't be choosing that particular housing option. So certainly within our catchment, it is a demographic predominantly adult men, many of whom are living in, all of whom are living in low income, and many of whom are living in that concentration of rooming houses.
Thank you very much.
Thank you for the question. And maybe I'll just add that I think that when we look at substance use broadly, it is across all demographics in all parts of our city. And part of the point of this report is that we need to have approaches that target different populations. So work with rooming houses is very important. And then there are other populations we can reach, such as through festivals and other peer-to-peer approaches are needed, through industries, certain categories of employment. We know people are at higher risk, and we need to have a different approach for those situations. The question of why are some people using substances there's many factors, it's multifactorial. Often we look at childhood, and trauma in childhood can change the development of the brain and how people may be more predisposed to substance use as one of the methods that is a result of that. There are a lot of different reasons. Some people are given prescriptions for a bad back. So I think there are different pathways, and that's why you see this report tonight is a piece of the work, but we need to tackle it on many fronts with many partners, especially on the prevention end.
Thank you. Again, thank you for coming out tonight and presenting. Much appreciated. Our final delegation tonight is Rob Boyd from Sandy Hill. Good evening, Rob.
All right, good evening and thank you. It's hard to believe how much has changed in the last couple of years. It's absolutely astounding how even the delegations tonight are different from what we've had before. So I'm from the Sandy Hill Community Health Center, so we are one of the sites who are partnering in the Safer Supply program. We are one of the sites that operates a consumption and treatment service. We also offer addictions and mental health treatment on site, including opioid agonist treatment. So we're a comprehensive community health center program that specializes in working with people who use drugs and people with mental illnesses. First, I would like to commend Dr. Etches and team and the work that they've been doing to combat the drug poisoning crisis in our community since it started, and particularly in the last couple of years, because so much has changed. The report outlines the extensive work that they've done to gather the stakeholders together to come up with the action plans that are very concrete, improving our response to really an ever-changing public health crisis. This is changing almost day to day what it is that we're seeing out there in terms of what's being funded or not funded, the drug supply itself. It's a wildly changeable experience for us on the front lines, and public health has been very helpful to keep moving us forward. They were on the ground with the take-home naloxone distribution program, Ottawa's first sanctioned and operating supervised consumption site, which really came together very, very quickly, as Andrew would attest, in response to a spike in overdose deaths in the summer of 2017. Even as access to evidence-based care such as consumption and treatment services, take-home naloxone programs, and opiate agonist treatment has expanded in the city of Ottawa, the problem continues to get worse because the drug supply is becoming more toxic, has become more toxic during the same period of time. When we started advocating 9 years ago for supervised consumption services here in Ottawa, the drugs we worried about were OxyContin and hydromorphone. Then we worried a little bit about the fentanyl patches as they came in. Whereas today, what I'm worried about is these really variable drug cocktails, where absolutely no sample that we're testing anymore is the same as the previous sample. We're getting wide variability in what's in the substances that people are purchasing from the unregulated market, and wide variation in the potency and the concentration of the drugs. So if you're taking an opioid, the higher the dose, the longer you're on it, the more likely you're to overdose from it. When you have fluctuations like this happening in the drug supply, there is no way of achieving a steady state so that you are at constant risk of overdose with this drug supply. So what that means on the ground for us is that we are completely overwhelmed in terms of consumption and treatment services. People who were injecting OxyContin and hydromorphone were reporting that they would inject 3 to 4 times a day in order to maintain that steady state, to stay even, whereas it comes to these fentanyl analogs and the combinations of what people are injecting now, they are injecting 9 to 12 times a day. So we have significantly underestimated the desire for people to uptake these services, and we've significantly underestimated the frequency with which they were going to inject and need to have supervised consumption services. So we are quite overwhelmed. All 4 sites are quite overwhelmed, and any loss to that capacity to provide supervised consumption in the system would have devastating results. So we were devastated to learn that Ottawa Public Health's funding was not going to continue because we can't afford to lose any capacity to respond. When it comes to the question of safer supply and what it is that we're hoping to achieve with this, is we're actually trying to reset back to the time when we used to worry about OxyContin and hydromorphone, a time when the interventions that we know would work. Because when it comes to the supply that we've got right now, quite frankly, nobody really knows what to do with this. This is an unprecedented public health crisis that we're facing right now. And our best bet at this point is to try to return to a supply of drugs that's going to respond well to this. And as Mark had outlined, to give people the space. If you are spending your entire day focused on acquiring money, acquiring drugs, doing the drugs, and this cycle is happening over and over, there's no space in between there to stabilize. There's no time to have a conversation about what else is that I want to do other than seek and use drugs. So it's really important for us to have this going forward as a strategy, as part of our community response to this overdose crisis. I appreciate also the public health desire to look at those who we're not reaching with our existing programs, those people who are using drugs recreationally, people who are using drugs in the privacy of their own home and overdosing, which is predominantly who we're talking about. We could reach some of the injection drug using population, but this is a population that do not see themselves in this story, do not see themselves as being at risk of an overdose. And the data is very clear that this is a key demographic that we need to find a way to reach. So I do encourage the Board of Health to approve the next steps for Ottawa Public Health's harm reduction program as outlined in this report. We need Ottawa Public Health at the table and on the ground. Thank you.
Thank you very much for coming out tonight and sharing experiences at Sandy Hill, like Somerset West. I think it's really helpful to this group, informative as to how we need to make this decision. So thank you very much for that. I don't see any questions for this delegation, so thank you very much. I now have a list of members that wish to ask questions to staff, and first was Councillor Cloutier.
Thank you, Chair. Thank you very much for the presentation and all the work that OPH does. Do we have any indication? We have the data for 2018, and you indicated that it was up 28% from 2017. Any indication in 2019 of how we're tracking?
Yep, so I'm looking to Dara, who's our epidemiologist, in terms of coroner data. Do we have any preliminary data from the coroner for 2019?
Yeah, we do have Q1 for 2019 data, and I'd have to look at the specific numbers right now, but yeah.
Perhaps you could share that with the board when you get it. You said that naloxone was underutilized in 1% of the time. Is that because, do you think that's primarily because of its availability? It wasn't there at that time. Is it education? Is it supply? Is it distribution? Lack of knowledge? What?
So it could be a combination of a variety of things. We know that we've done a good job of distributing naloxone kits across Ottawa. So per capita, we're one of the highest across Ontario, and so we have a couple of ways in which we can distribute naloxone. One is through the Ministry of Health's Ontario Naloxone Program, which has over 200 pharmacies here in Ottawa that can distribute naloxone. And so those are for people who would prefer to go to a pharmacy in order to get their naloxone kits. And then one of the services that Ottawa Public Health offers is the peer overdose prevention program, which is a little bit more of a targeted approach to reach people who have loved ones, families, friends who might be at risk of overdose. So through those two strategies, we do feel like we've done a decent job in getting naloxone kits out there. Yet when we get the coroner data, and that's to your point, we're hearing that naloxone is always not nearby for people to use that. So so there's still some work to do in that area in terms of letting people know that naloxone is available, that it's a way in which it's a resource that's available for people to have kits nearby. Part of it still comes back to stigma. So a big part of the community action plan in terms of substance use and mental health has to do with stigma. Some people might feel that they're not having issues when it comes to their opioid use, and they might not need a naloxone kit. And so that's really one of the highlights or one of the key messages of this work is that the anti-stigma work that is required and that we're doing in partnership with the CCSA is really important, and that covers naloxone as well as to some of the mental health work that we want to do. Yeah.
Thank you very much. Member Kavanagh.
I think I'm good now because I've got a lot of the questions I had answered with the delegation, so thank you.
Thank you. Member Banham.
First, I'd like to thank all the delegations for their presentations and the hard work that they do. It's very clear that the work you all do are making our community safer. I have a couple questions. So the first one, and it might be that you might have to get back to me or the board. I'm wondering about other data regarding the scope. We were informed of the unfortunate 82 deaths, but I'm wondering if there's more data available regarding ER visits or significant morbidity, because I think defining the scope as it is obviously much broader than the incidents that result in deaths. So I'm wondering if you can get back to us on that. And then the next piece is about the education of harm reduction to other allied health providers. And I'm wondering how far along we are in that plan, or whether there'll be a community consultation of allied health providers that might be interested in becoming involved in getting that training. And then the last one is about thinking about ER visits and the care that's received once they go to ER. We know that people working within the ER are jacks of all trades, right? They have to be educated in many, many different things. And so I'm wondering if they might be at the higher end for receiving that harm reduction training.
Yep, thanks for the question. I do see your second question and your third question as combined, right? So in terms of how far along we are in terms of working with allied partners, I'd say we're in the beginning days of working with them. I mean, this approach was highlighted in February 2019, where we brought together over 200 partners to talk about this. And so this was basically a call from our partners that this work was required, and that this is a role that Ottawa Public Health could play in terms of reaching the entire city, right? And so through partners, we can broaden our reach. And so the example that I talked about was with the Royal, in terms of some of the work that we did with them in terms of their naloxone distribution within their facility, some of the work that we did on the floor with them. And so I think that really provides a real nice nice framework for what it could look like in other hospitals. And so the other hospitals are kind of on the top of the list in terms of an area that we do want to do more outreach and more work with partners. And emergency departments is a good example of an area that we do want to focus. We do know that from our clients, from those who are more street involved, is, you know, there's a they don't really want to call 911 sometimes, right? So they'll come to our services, or they'll come to some of the services at community health centers because of the fear to go to an emergency department. So we know that there's work there, and we've heard from emergency departments and from hospitals that there's an interest in working with us on that. So in terms of the other data, I know that we can get back to you on that. I know that the coroner has made a lot of progress over the years in terms of getting the information to us in a more timely fashion, but also having more different data points in that. So that's absolutely something that we can follow up with you on.
Thank you, Andrew. Member Menard.
Thanks very much, Chair. Thank you for the presentation and information. It's nice to see. I'm glad to see the direction that we're taking, and the push to save lives with safer supply, which we know it does. That's the evidence. So it's important that I think we're taking this direction. We've applied to Health Canada with a number of partners. Has there been any discussion with them in terms of where this is at? Is it looking hopeful that this would take place and happen?
Yep, so I mean, we submitted the proposal in hopes that it gets approved. So we have regular conversations with Health Canada just because we operate as supervised consumption services. We also have regular conversations with the division, the substance use and addictions program that funds those types of proposals. They are keen in getting going with the safer supply initiatives. The timelines that we have heard from them is they want to make decisions in December so that they can implement and distribute funding in January. So that's not very far away, which indicates to me that they're interested in moving forward. In conversation with them, one of the things that I did talk to them about was that they're interested in partnerships. They wanted applications that were coordinated across a city level, and that's very much the application that we put forward. So I think we're in a good place to see that be successful, but time will tell, and we'll know more information in a short time.
Okay, thanks for that. That's really helpful and good to hear. In terms of the supervised consumption service and our sort of January 1st, 2020 timeline and the change that's going to be happening there, I had a good conversation already with the chair and Dr. Etches about this, but I just want to make sure that we know, the public knows, in terms of a transition plan that we're instituting, the levels of service for folks and the service that they'll get nearby, that we have some assurances that we're not going to have a big gap there, that people aren't going to be left without the service they require, and that the transition plan that we're putting in place is something that's going to be effective. Can you give me more information about that and how we're going to ensure that happens?
Yep, thank you. So, I mean, our main priority is to make sure that people aren't falling through the cracks. And so the transition plan that we've been working on has been in combination with partners, so the other supervised consumption services, employees, right? So our own employees have provided insight in terms of what a transition plan could look like, as well as clients. So we knew that this report was going public with the notion that we'd be changing the hours, and so we've already started engaging clients in the last couple of weeks in terms of what this change in service hours could mean to them. And so, what we heard from partners was that that they're all at maximum capacity in terms of their services. And so that what could help is having some of our staff work with them and walk people over, right? So we did that a couple of years ago when Overdose Prevention Ottawa discontinued their services. So actually physically walking people to other services was helpful. We heard that. And so we're gonna continue to do that. From employees, what we heard from them in terms of conversations with people is that this work is making a difference. We know that clients have told us that what they preferred from our model, our service model, was that it was a little bit more therapeutic. It was smaller, it was quieter, and we heard from people that, from clients, that there may not be a preference to go to other services, and so I think reducing some of those barriers and physically bringing them to other services and just making them aware that those services are okay to access is part of the plan. So we're going to continue to talk to them. We have about another 6 weeks before we make that change, that we're going to continue to develop individual care plans for people so that we can really maximize the chances that they're going to access services elsewhere.
Okay, and the capacity at our partner service centers is expected to grow in terms of availability. Can you confirm just in terms of numbers what we're looking at with that?
Yep, so the nearest service to us is about 240 meters away. It's the one that's operated out of Shepherds of Good Hope. They just received announcement from the province around their ability to renovate their space. So they've been operating out of an interim space since they've started a couple years now. And so they're now actually moving forward imminently with their renovations over the winter months. And with those renovations, they're going to be able to increase their capacity by a couple booths, but it'll also improve the flow of services within their interim site. And so in conversation with them, they do feel like they'll have increased capacity over the next couple months. They're expecting the renovations to be completed by May 2020, which is good news. So, between conversations with them and through Sandy Hill, which is also nearby, we do feel like there's going to be increased capacity over the next couple months.
Okay, thank you very much. Appreciate all that information.
Thank you, Member Menard. I don't see any other questions, so do we carry this? Carried. Thank you very much. I'm going to ask the Vice Chair to take over for a few minutes, and I will be back when we're dealing with the budget. Thank you very much.
Okay, with that, we're moving to number 2 on the agenda, the Medical Officer of Health verbal report, and I call on Dr. Etches to provide her verbal update.
Good evening, bonsoir, Quay. Ce soir, je tiens à vous offrir un compte rendu des travaux de modernisation de la santé publique, des efforts de transformation du système provincial de soins de santé, et vous faire part des travaux qui se font à l'échelle locale pour Santé publique Ottawa. So this evening, I would like to provide you with updates on public health modernization, the transformation of the health system provincially, and highlight work happening at the local level with Ottawa Public Health. So with respect to modernization, OPH continues to follow provincial developments and announcements and to seek opportunities to strengthen our public health system. At our last meeting, I shared that the province was looking at a renewed consultation process led by an expert advisor who had yet to be named, and since then the province has announced the appointment of Mr. Jim Pine, Chief Administrative Officer for the County of Hastings and a former member of the Board of Directors of the Association of Municipalities of Ontario, to serve as advisor for the upcoming consultations on modernizing Ontario's public health sector and emergency services. It's expected that the consultations will begin this fall and will culminate in a report to the Minister of Health, Christine Elliott. The province has explained that Mr. Pine will travel across Ontario, consulting with numerous organizations and partners, including boards of health, public health experts, the Association of Municipalities of Ontario, as well as unions. We await the release of a discussion paper, and I do look forward to the opportunity to meet Mr. Pine and talk about strengthening our system. Recently, I've had opportunity to attend meetings in Toronto to discuss modernization with various provincial representatives, and I look forward to continuing those conversations even tomorrow when I return to Toronto to advance conversations in advance of the Association of Local Public Health Agencies Symposium. Je quitte pour Toronto demain pour continuer mes conversations avec divers représentants de la province. So moving to the subject of the health system, broader health system transformation, I also want to update you on the Ontario Health Team applications. So you'll recall that in September, the Board of Health carried a motion supporting Ottawa Public Health's continuing involvement in Ontario Health Teams. Nous avons eu chance de supporter et participer aux soumissions finales de 3 équipes de la région Ottawa, soit the Ottawa Health Team led by 6 Ottawa area community health centers, the Ottawa East Ontario Health Team led by the Hôpital Montfort, and Kids Come First Ontario Health Team led by CHIO. And following the September Board of Health meeting, these applications were submitted to the Ministry of Health, and the Ministry has advised that it's now going to conduct on-site visits with 3 of these teams next week. The visits are intended to provide the Ministry with an opportunity to discuss the content of the full applications they received in more detail. So we look forward during these visits to describe and elaborate on the value of public health participation, especially around driving prevention across the healthcare system. And we'll keep the board informed of progress. Enfin, nous lancerons cet automne la 2e étape de notre campagne sur le cannabis. Mais sérieusement, qui encourage les résidents à prendre des décisions éclairées au sujet de leur consommation de cannabis en leur transmettant des messages fondés sur des données et dans le but de réduire les risques de la santé. So this fall, we're implementing that second phase of our Blunt Facts cannabis campaign. And this will roll out before the new cannabis products become available in December. That's foods, edible foods, beverages, cannabis extracts and oils that can be vaped, and cannabis topicals such as ointments and creams. The campaign builds on the messaging that we use from the Canadian Mental Health Association, the Canadian Medical and Nurses Association, the Canadian Public Health Association, and the Centre for Substance Use and Addictions. It's encouraging people to make informed choices about cannabis by providing evidence-based messages and a harm reduction approach. So although it's not possible tonight to highlight all the great work being done by Ottawa Public Health teams, you can see from the topics discussed so far this commitment of the Ottawa Public Health employees have to promoting and protecting the health of Ottawa residents. So I'm always grateful for that work. I do want to add my thanks to Kira and the harm reduction team, especially as we note another time of transition, the way they've been flexible and really risen to make a difference for people in our community. Miigwech, merci. Ceci conclut ma mise à jour verbale et ça me ferait plaisir de répondre à votre question.
Thank you, Dr. Etches. Are there any questions? Member Banham?
This is not a question, but I just wanted to say that the video that was launched last week, was it, by Ottawa Public Health was so fantastic. I did share it and received a lot of great feedback. So I just wanted to give congratulations to the team who worked on that video and the Ottawa Public Health actors. They were phenomenal. So I just wanted to give kudos for that.
Thank you. And I would agree. I hear there's a sequel in the works as well.
Sure. I think I'm going to jump back in because I missed a little bit of my verbal update turning pages. But it is on the message of making sure Ottawa Public Health is visible, right? So that was the purpose. That people sometimes don't understand what we do unless something goes wrong. So trying to help that. And considering the modernization conversation, making sure people understand is I did want to point out that Blair Patakirk is over sitting beside Eric Leclerc, whose team's responsible for the video. Eric, thank you to the team. And Blair Patakirk has joined us to help with more senior level support with stakeholder and government relations. And so he's with us on a part-time basis, and I look forward to drawing on that expertise around modernization as well. And the piece that I missed about our internal work is that we're continuing our work on the development of electronic public health records. So this I think is important in terms of it's transformational. It will change how we work for many years to come. Right now what we're focused on is replacing our processes, improving our processes to going from paper to electronic. And I can tell you I'm excited by just when I hear the numbers of paper forms that are being reduced. It sounds great, but it's a lot of work. It's very labor intensive, and we know that what we're aiming for is a system that has a new functionality as well, that's open to be visible by clients, that is interoperable with electronic medical systems across the health system. So just a little update on that is underway.
Thank you. Are there any further questions? So with that, the Board of Health of the City of Ottawa Health Unit receives this report for information. And given that our next item on the agenda is a report from the chair, I'd propose that we take a slight recess for probably 5 minutes, and then we'll regroup. Thank you.
One is my verbal report, and the other is the tabling of the budget. So we'll do the verbal report and then the tabling of the budget. And thank you all for being here tonight. I'd like to begin by honoring the Algonquin people on whose traditional unceded territory the City of Ottawa is located. I'd like to extend this respect to all First Nations, Inuit, and Métis people, their ancestors, their elders, and their valuable past and present contributions to this land. In tonight's verbal report, I'll be providing updates on actions stemming from a board motion, new provincial vaping regulations, and local flu clinics. At our September meeting, you might recall, the board approved a motion recommending that City Council request that Mayor Watson ask the Minister of Health, Christine Elliott, to maintain the relationship between the City of Ottawa and Ottawa Public Health. At its meeting of September 25th, I'm happy to say that Council unanimously supported the Board of Health recommendation, which talked about the importance of maintaining OPH's relationship with the City in order to maximize the coordination between public health programs and municipal services, and the benefits derived from the integration of administration and other efficiencies. As requested, Mayor Watson was more than happy to write the letter to the Minister of Health and convey that request. My hope is that the motion and the subsequent actions, will garner support for maintaining the current relationship and encourage the province to recognize the City's ongoing in-kind contributions in calculating future budget allocations. Next, I want to talk a little bit about vaping. On the topic of vaping, earlier this month, I worked with Mayor Watson, and a letter was sent again to Minister Elliott on the need for provincial regulation to decrease the harms of vaping. The letter highlighted the increasing prevalence of vaping among youth and pointed to the work OPH is doing with Ottawa school boards on this subject. On October 25th, the Minister announced that Ontario is taking urgent action to address the issue of youth vaping by banning the promotion of vapor products in convenience stores and gas stations. Starting January 1, 2020, the promotion of vapor products in retail stores will only be permitted in specialty vape stores and cannabis retail stores, which are only open to people aged 19 and over. I'm very grateful for these first steps the Ontario government is taking to address the issue of vaping. This is an important measure to reduce the impact of vaping product marketing and advertising to youth and non-users of tobacco products. This was, if you recall, the meeting where we discussed this last was a very engaging topic, a lot of interest amongst the board members on this. I can tell you there's a lot of interest amongst my council colleagues. They're seeing it in all their wards, they're seeing it at all their schools. And so this step by the government is much, much appreciated, and we hope is the first of many to come so that we can rein in vaping, especially amongst our youth. Flu season, unfortunately, is now upon us. This past weekend, OPH held its first community influenza immunization clinic, and it was well attended. Over 1,300 vaccines were given, which is up 37% from last year. OPH will be offering 9 more community clinics in different areas across the city until November the 20th, 2019. Clinics are scheduled in areas where there are many young families, older adults, and where there are fewer pharmacies offering the vaccine. I encourage everyone to get the flu vaccine I know that the staff OPH is organizing a television segment for later this week where a number of us, and hopefully most of us, will be able to go out and get our flu shots. Dr. Etches will be there, but I'm told she's not going to be giving the shots. But we will have a very capable OPH nurse there to help us out. And again, I can't say enough how important it is at this time to get the flu shot. It's not just about you. It's about the vulnerable populations that you interact with on a regular basis. It's about the young children. It's about the babies. It's about the seniors. So it's a very collective and collaborative effort we have to do here. So the more of us get vaccinated, the more of us that are going to be protected. So I can't urge you enough to go out and get your shot. And that concludes my verbal report. I welcome any questions. Seeing no questions, received. And now we will move on to that other seasonal event, which, depending on your perspective, is better or worse than the flu, and that's budget season. So we're going to table the budget tonight. I'll have to remind members of the board that it's high-level questions tonight only. We will have an opportunity later on within the budget cycle to have full debate and questions. But at this point in time, as I say, it's high-level discussion, high-level questions. I'm going to turn it over to Lou and his team to present the budget.
Thank you, Chair. Tonight I'm joined by Brenda Gordon of the Finance Department and by Samantha Gossam from OPH. And before I'd like to begin, I'd like to thank them both and Victoria Cowell for their roles in the preparation of this budget. Tonight, as we table the 2020 budget, we will cover a brief overview of our programs and funding sources, priorities, budget considerations, provide an overview of the 2020 budget changes, and finally, budget timelines. This budget reflects the latest information we have from our funding partners and our best judgment on emerging health issues, identifying efficiencies, and reinvesting in community needs. Setting priorities for 2020, teams across the organization considered emerging health risks, community need, strategic priorities, compliance with the Ontario Public Health Standards, and changing funding requirements outlined by the Ontario government. The draft budget seeks to work within our financial parameters in order to continue to deliver services that the public require. Tonight, we are presenting a balanced budget of $73.7 million, which also includes the city support costs of approximately $9 million. It aligns with city guidelines for budget development and includes an increase of $475,000. It assumes a 70% provincial, 30% municipal funding for mandatory programs with some exceptions. All new growth initiatives totaling $3.6 million are provincially funded at 100%, and efficiencies of $1.4 million are required in order to balance the overall budget. This next slide provides a little bit of background on the various programs that OPH has. So the first category is the cost-shared funds, and they're used to deliver programs to adhere to the Ontario Public Health Standards as they relate to the Health Protection and Promotion Act, and they represent the majority of the OPH budget. For 2020, the cost-shared formula will be 70% provincial and 30% municipal, as announced by the province in late August, and in OPH's case, we're already meeting that funding ratio. The next largest envelope is 100% provincially funded programs, which include Healthy Babies, Healthy Children, and several new programs such as the Ontario Seniors Dental Care Program, cannabis, Indigenous health, and various other programs round out that category. Next are 100% city-funded programs such as mental health, substance use and injury prevention, and school-based outreach. Adult dental expenses are recovered from community and social services, and revenue is also generated through miscellaneous fees and services, which include OHIP billing, immunization, as well as contraceptives and medical supplies, inspection searches, and food handler training courses. This next slide provides a high-level summary of the 2020 base budget changes. In order to maintain existing services, the budget includes a provision of $1.2 million for future negotiation of collective agreements. Next are new growth programs such as Ontario Seniors Dental Care Program for $2.76 million, Indigenous Health funding for $298,000, and cannabis program support and enforcement for $500,000. All these new programs will be 100% provincially funded. The final two items include funding, the reduction of funding for supervised consumption services of $885,000 and efficiencies of $1.355 million in order to balance the budget. The revenue changes include a $475,000 funding increase from the city, which is drawn from the overall city tax increase, new provincial funding of $3.56 for growth initiatives outlined above, a reduction of $630,000, which was requested to cover the provincial portion of the 2% cost of living compensation increase assumed in the 2019 budget and was not approved, and an adjustment for the discontinuation of funding for supervised consumption services. Finally, as a result of conversations held with provincial representatives, this budget does not assume any provincial funding increases in order to maintain existing services. This next slide represents the budget approval timeline. After tonight's meeting, the Board of Health budget will be tabled with City Council on Wednesday, November the 6th, and then return to the Board of Health on December the 9th for public delegation and approval. Public feedback occurs from this point forward to the December 9th meeting. However, it should be noted that client and external stakeholder input has been obtained throughout the year and continues to inform the budget process. Inquiries can be directed to Deanne Blais. And finally, in summary, we are presenting a budget that considers the latest information provided by the provincial government, includes new programming for emerging areas, and requires reductions to existing resources in order to balance the budget. We welcome questions at this time.
Are there any questions on the budget? Member El Shantiri.
Thank you, Mr. Chair, and thank you for the. I know this is the tabling of the budget, but when you talk about efficiency, did I hear correctly? $1.4 million in efficiency. How you plan to achieve this?
So the majority of the public health budget is compensation. It's 75% of our budget. So a portion of the efficiency is through reduction of positions, of 8.3 positions. And those positions are vacant. And so we're reducing vacancies. And then also we're reducing professional services, advertising, program supplies in order to get to the 1.4 million.
And are we doing, again, on a high level, are we doing this to meet the budget line from the province? Or, I always love efficiency, but I just don't like the idea to have a number and not to be able to achieve. That's what I'm looking for. If this number, are you comfortable with, you'll be able to achieve it by next year, the 1.4 million?
I think we're comfortable. We've, this year was, we were expecting a lot of change this year in 2019. And so in order to balance the 2019 budget, we have a position management internal process where we maybe kept some positions vacant or filled temporarily in order to give us flexibility in order to balance our budget. So, with various interaction from senior levels and the management staff, we feel that we should be able to achieve these efficiencies in the upcoming year.
And I'm looking, trying to figure the percentage increase from the city portion. What percentage would that represent?
So in rough terms, the city has provided $475,000. We have a budget of about $70 million, just $73 million. So I think that would equate to just over 0.5%. We'll quickly do the math for you.
So, if I may, Member Alshantari, the increase from the city is 3.5%. It's a 2% on the tax base and a 1.5% growth in terms of just the change over the municipal base. So it's just that answer.
Well, I was going to ask it the other way. And forgive me because I haven't been on this board for. Does this board receive the growth assessment separately?
That's right. So it's tax-based and growth money.
Okay,
We receive both.
Okay.
And to your other question about can we handle this efficiency, I'm really proud of the team that actually involved a lot of employees, frontline, middle management, senior management, in terms of looking at different ways we can do things, where can we align work that could be done in a different way. And it is equivalent to 2% of our budget. And so, you know, this is the first round of looking at what can be done, and I'm really pleased to be able to say that no one will be losing their employment. You know, that we're able to prioritize keeping that capacity.
I totally agree, but we've seen too many times to balance the budget. We use them as a number for efficiency, and then we cannot achieve them because it's almost impossible to be achieved. And that's why I asked the question, is that number we're going to be able to achieve? And the answer was, I think, clear from both of you. Thank you.
Are there any other questions? Member Kavanagh.
I'm wondering about the work with the official plan and how that fits into the budget. Are the staff seconded and then they're on city budget, or is it in this budget? I'm not sure. Sorry, I haven't seen it yet.
Yes, so part of the filter that we asked everyone to use when they thought about our budget and efficiencies and what do we need to be doing was our strategic plan. So let's advance mental health and substance use, let's advance driving prevention in the health system, wellness at work, and as you say, the work on the city's official plan, which fits under creating healthy social and physical environments. That work continues to be paid for out of our budget. There's no additional support from the city for those salaries. That continues in this budget.
Member Menard.
I think I saw Member Kluche's hand up first. I'm sorry if it's up to you. Okay. No, okay. No, thanks, Chair. I'm still kind of going through things, but so thank you for the budget. Just a couple of things stand out. I know we're high level here. The reduction in the supervised consumption services we just talked about. I thought last budget we reduced that in anticipation of not receiving the grant. Was it reduced to the extent that we're seeing the 885 now? Was it reduced then, or is it just we're just factoring it in right now? I thought last budget we had an item on that too.
Yeah, it's somewhat a little confusing. What happened was that from January to March, we still had the provincial portion of the supervised consumption funding that was approved the prior year because they operate on a fiscal year. Right. And then shortly thereafter, we also received federal funding of $588,000. So when you add the federal funding plus the provincial funding, it adds to the $885,000, okay. And it's one time. So as of the end of 2019, it ceases.
Okay, that's very, very helpful. Thank you. And I guess a question to Dr. Etches or whoever, but are we preparing in this budget to be doing the type of communication and materials that we need to do that on the benefits of Ottawa Public Health in advance of the decision of either amalgamation or hopefully not for Ottawa? Is that factored into all of this as well, that we've got capacity there to make sure we're doing that type of good work that we've been doing the last little while?
Yes, thank you. I appreciate the support to make sure people understand the value of what we do. I think you've seen with the release of the video last week, that was one avenue. Another avenue is paying for my travel to Toronto, those kinds of conversations and make sure we're visible. I mean, really, as a whole team, that's one of the things we are trying to do in our day-to-day work is help people understand what we do, which doesn't take a lot of money. You heard how partners tonight spoke about the work being essential. We're really drawing on relationships and others to voice that is important, I think, in this time. So I would say there's no specific line item for that work, but it's part of our communications and part of our way of approaching the work right now.
Okay, thank you.
And if I can add, I mean, Dr. Etch just touched on it a little bit with the video, but it's so much more than that. Public health social media presence, obviously it's not free. There is a cost to it, but it's in terms of expenditures, it's a very cost-effective way, if you will, getting the message out. The video is one example. Our Facebook page, correct me if I'm wrong, Dr. Etches, has more followers than any other public health Facebook page across North America. So we have extraordinary outreach by way of social media, and that's not a just let's talk about it at a budget time, but that's a year-round thing that we continually push forward. So there's always room for improvement, but it's sort of a core value, I think, of this team to constantly push that message. This is what we do, and of course we can do that all the better with the members of the health board and councillors at large and we saw that last week as well, and all the councillors that pushed out the video through their various social media feeds and Facebook and websites and everything else. So it's not just a budget focused piece, but it's a year-round thing that we continually work on.
Okay, thank you very much, Chair. That's helpful. In terms of the timeline for the provincial discussions around potential, amalgamations, does that factor in? Just remind me of the timeline. Will this be a standalone budget for the next fiscal year, or is there a chance it's affected by that initiative?
That's a good question. Of course, we don't know definitively, but we are building our budget based on no change in governance for 2020. Initially, the province spoke about having a regional public health entity in place for April 2020. I haven't heard that mentioned lately, and we understand the consultations and the process to put forward any suggested regulation that would establish something like that would take time. They've heard loud and clear that you need transition time on top of that. So, how you form a new board, how you look at all of the infrastructure, depending on the different models, it's going to take time. They've heard that. So I feel confident that we can continue with this budget for 2020.
Okay, thank you.
And the other piece, they promised that they were going to appoint a province-wide liaison to work with various health agencies. That finally just happened within the last couple of weeks. We have reached out. We said, welcome to the table. He's thanked us for that. But in terms of setting up any formal consultations, they're promised, but that hasn't even started yet. With Christmas next month, I suspect we're probably not really going to get into the thick of that until sometime in 2020. And then, as Dr. Etch has pointed out, there's whatever we come up with at the end of the day, that has to be turned into legislation and regulation. So there are no guarantees in life, but I think this budget will carry us through most, if not all, of next year without change.
Okay, thank you very much.
Member Couche, rather.
Merci, Monsieur le Président. Thank you very much. Thanks for the presentation. On slide 5, you highlighted the Ontario Seniors Dental Care Program, cannabis, and Indigenous health, and I find those numbers in the budget document, along with their revenue at 500, their expense 500,000, 298,000, and 2.7 million. And I understand they're provincially funded. Have those agreements? My question is, are those funding agreements solid? That revenue will pay for the. We have an agreement with the province on those items.
Yes, we did receive confirmation for the dental and for the Indigenous health. And we're believing that the cannabis money's there as well. That's why it's been built into the budget.
We have a high degree of confidence that's not going to be an issue.
That's right.
Thank you.
Member Gower.
Thank you. I just wanted to clarify point number 5 under the report recommendations that we're being asked to approve tonight. The point number 5 is about upon approval of the 2020 budget, sending it for consideration to the Ontario Ministry of Health. I just wanted to make sure Ontario Ministry of Health doesn't need to approve our budget. This is strictly making them aware and consideration. Can staff just clarify that one?
Yeah, I think that's after we obtain approval from the board and from City Council, then we have to apply for funding through a process, and so that allows us to then go to the next step and submit the application for funding for the upcoming year. But they do not, so that, yeah.
The province won't simply pay what we suggest the figure is they should pay in our budget. We have to wait and see what they decide to pay us, and that amount usually comes through in August or so each year. So this budget makes that assumption of what the province will pay us, and it makes a conservative assumption this year in that we're not expecting any increase at all from the province apart from the new programs that they've said they would fund. So that's part of what we are needing to find efficiencies to handle, is no growth from the province. Beyond that, there is also an assumption in here that the province will accept that the municipal contribution's already at 30%. It's possible they don't like that calculation. They don't want to, they have a different approach potentially to the budget, and if that's the case and there's more of a budget pressure, then we would be reporting back to you for sure. We know in that case they have said that there's transitional funding available for cities, boards of health, when the pressure on the budget due to the funding formula change is greater than 10%. So that would be what we would try to access first, is transitional funding. And further, if there is still a gap, then we do have good relationships with the city. The chair spoke to council at the time of the motion that went forward about this relationship with the city, and council was supportive. The treasurer indicated, I believe, that in fact they will help public health if needed.
Okay, thank you.
Any other questions? Okay, seeing none, we have two things to do here. One is to receive and table the 2020 draft operating budget for the Ottawa Board of Health. Secondly, direct staff to forward the 2020 draft operating budget for the Ottawa Board of Health to Ottawa City Council on November 6, 2019, as part of the City Council's tabling of the City of Ottawa 2020 draft operating and capital budget. Carried? Okay, thank you. Motion to adopt reports. Vice Chair?
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Next Steps in Harm Reduction and Overdose Prevention, Child Visual Health and Vision Screening Services, Board of Health Travel Policy and Enhanced Code of Conduct, attendance at the Association of Local Public Health Agencies, ALPHA 2019 Fall Symposium and BOH Section Meeting, and 2020 Ottawa Board of Health meeting schedule be received and adopted. And be it further resolved that the report titled 2020 Draft Operating Budget for the Ottawa Board of Health be tabled for consideration at the Board of Health meeting of December 9th, 2019.
Thank you. Carried? Carried, thank you. Are there any motions requiring suspension of the rules? Seeing none. Any notice of motion for consideration at a subsequent meeting? Seeing none. If I could ask the Vice Chair to move the confirmation bylaw.
Be it resolved that confirmation bylaw number 2019-6, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of November 4th, 2019, be read and passed.
Carried? Carried, thank you. Are there any inquiries? No, seeing none. Can we adjourn? Please keep in mind that the next meeting is a special meeting. It's going to be on December the 9th, Monday, December the 9th at 5 p.m. here, and it will be to consider and carry, hopefully, the budget. Okay? Thank you very much.